Without a doubt, the type of birth that you might have, labor and a vaginal birth, labor and an unplanned cesarean or an emergency cesarean, a elective or non-laboring cesarean, or a vaginal birth after a cesarean, a VBAC, have now become the topic of conversation. Those really weren't the topic of conversation even when I gave birth in 1970. First, there were no VBACs, and cesareans were done in a classical way, which meant that you were cut from your pubic bone to your belly button. And if you had 2 or 3 cesareans, you were encouraged not to get pregnant again. My sister-in-law had a ruptured uterus after her first cesarean when she was 9 months pregnant. Her baby died, but she survived. So I know that the threat of a uterine rupture was real back then. It's not real now because women no longer wanted to be left with an ugly scar. So the medical profession came up with the bikini cuts because we were wearing bikinis in the 70s and the 80s. And we could then cut the uterus and split the muscles rather than cut them this way, which meant that it's become much safer to have a VBAC now. But we've also been very confused about the type of birth. There's a belief that if you labor and have a vaginal birth, that you're sort of having a natural birth or a normal birth. But then, of course, within that, women who birth at home are considered to have a natural birth, whereas women who birth in the hospital are considered to have a medical birth. And it even gets more complicated because if you go to the hospital with the hopes of having a natural birth, if you have one of 28 interventions, whether you can't move around, or you have your membrane stripped, or your water bag broken, or you have pain relief, or you have forceps, or a ventouse, or a cesarean, or an induction, or an augmentation, or you can't eat, or you can't drink, all those things then apparently rob you from having a natural or normal birth. If you have a labor and have an emergency or an unplanned cesarean, that of course isn't a normal birth. If you have a non-laboring cesarean, obviously you're not even giving birth. If you have a VBAC, it's going to end up with one of those 3 births. And a VBAC's sort of a false term anyway. It's vaginal birth after a cesarean. Well, 99.9% of all cesareans occur in labor. So the reality is that when we used to use the term trial of labor was more realistic than vaginal birth after cesarean because people seem to want to skip the hard part of labor. But no matter what type of birth you have, Birthing Better families developed skills so that all of us could have skills to do the activity of birthing our baby, because the birth of our baby is what's important to us. And 100% of pregnant women will give birth. So all of us could have skills to do the activity of birthing our baby. So how do we birth our baby if we're going to have an elective cesarean? Use the skills on the way to the hospital while being prepped and in surgery, and afterwards if you have discomfort. What do you do if you have a labor and end up with lots of medical care? You end up with lots of medical care. Keep using your skills. You're still doing the activity of birthing your baby. What happens if you labor and have an emergency or unplanned cesarean? Use the skills while you're being prepped and during surgery. It's still the birth of your baby. What happens if you birth at home unassisted? Use the skills. If you birth in the car, use your skills. There's no birth in which you should not be using skills to cope and manage, deal with, work through, handle, stay on top of, and in control. And that goes for your partner as well. They need the skills to help you do those things. Simple as that.